today on an all-new Dr. Phil. Nearly 1 in 5 children are considered obese.
The epidemic.
There's times when she says she wishes she was dead.
I've been beat up for allowing her to be a fat child.
Of childhood obesity.
You get picked on?
Yes.
Made fun of? Bullied?
Yeah. Put out my way.
Who's to blame?
Me being like this, that's my fault.
What if I told you that I couldn't disagree with you more? Let's do it.
Have a good show, everybody. Here we go.
This is a safe place to talk about hard things.
Stand by. We'll count you down.
Today is going to be a changing day in your life.
5, 4.
Get ready to take care of you. Well, today I'm going to tell you there is a growing crisis in the country and why it's time to sit up and pay attention. Well, nearly 1 in 5 American children or adolescents are considered obese. Take a look.
Nearly 14 million American children and teens are considered obese, raising their risk for heart disease.
Over the years, more kids have been identified as overweight or obese. According to the group Healthier Generation, it's now as many as 1 in 3.
Not getting enough physical activity and making poor food choices like this are leading causes of childhood obesity.
In addition to not enough exercise or watching what you eat, a lack of food options is a big contributor.
If there are food deserts, meaning that there aren't many grocery stores and there's more gas stations and convenience stores, then children and families have less access to healthy foods.
The American Academy of Pediatrics is out with new guidelines for the first time in 15 years when it comes to the treatment for childhood obesity. AAP now says weight loss drugs should be considered when treating children.
Rose Garcia says for as long as she can remember, doctors told her she was overweight. What did the doctor or others tell you to do?
Just to exercise and eat better.
With parental permission, she finally tried bariatric weight loss surgery last June, along with counseling for emotional eating. Since then, she has lost more than 90 pounds.
Basically, if a child has a body mass index over 35, or especially if they have a body mass index over 40, they meet criteria for intervention and not just with diet and exercise anymore. And we're not trying to push surgery as the first line of defense. Surgery is just another tool in our armamentarium to try to help these kiddos.
Well, one thing I want to make very clear, this is not about fat shaming children. This is about ensuring that our children lead happy, healthy lives that will carry on through adulthood. Now, Kim's very aware of the problem. She wrote in about her 13-year-old niece, Emma, who she says has been severely overweight since kindergarten. Take a look.
My name is Kim, and I'm hoping you'll help my niece. She was a beautiful, happy little girl until she started school. Through years of bullying about her weight, she's now very depressed. The bullying got so bad, she finished school online. She acts like it doesn't bother her, but you can tell it does.
I'm just hoping that you can help me feel a bit more self-love and like get over my insecurities. I'm in a constant battle with depression because of my weight, and all throughout my life I've been bullied for it.
I wish that she could see the positive things. She's kind, she's smart, she's very talented in music, art, cooking. I'm hoping that you can help her get healthy and to gain some self-esteem so that she can get through the cruel life she's going through now. Please, Dr. Phil, help us. I don't know where else to go.
Well, I hope you've come to the right place. And listen, every guest we have is a teaching tool, and I hope there are a lot of parents that are listening to this. And yeah, I mentioned up front, this isn't about shaming the child, because a lot of these choices are made for the children, right?
Correct.
They're made for the children by the government and what they're fed at school, when there are lunch programs. And I don't remember the last time I saw a child at 8 or 10 years old go out, get in a car, start it up, drive to the grocery store, go in, make all these choices, load it up, take it home, fix it, and eat it. They eat what's put in front of them, right?
Right.
And that, and of course, that's just part of it. You've got genetics and all sorts of things that figure into this, but you've watched this happen with her since, what was the earliest time where you saw her moving in the direction of departure from what would be a typical weight for a child?
A young toddler, probably between the ages of 2 and 3.
Okay, so really early on.
Yes.
She really wants this for herself, right?
Yes, she does.
Why do you think she does? Is it the bullying?
It's definitely a lot to do with the bullying. She has no self-confidence in herself, and it's to do with the weight. She makes remarks like, I want to wear cute clothes like the kids in my school, but all the cute clothes are for skinny children. And there's times when she says she wishes she was dead. It's very hard to deal with.
And both of her parents work. It's a double income family.
Correct,
Both
like
parents work,
most.
which is why they're not here today. And that makes it easier for her to have to rely on convenience foods, fast foods, less nutritious kinds of foods by default.
Right, and there's 2 other children. She has 2 sisters who are both also overweight, eating a lot of fast food and prepared,
Drinking a lot of soda.
Yes.
Okay. Do you think she medicates herself with food?
Yes, I think that she does stress eating. I think it makes her feel better. She also loves to cook, which, of course, if you're cooking, you're eating. She loves to bake, so there's the sweets.
Yeah. And you say she'll eat leftovers, others,
Yes,
her sister's leftovers and stuff.
Right. When we go out, I go up to visit her at least once a month, and we'll go out shopping, and then we stop for lunch, and she's always, are you going to finish that? Can I have a bite of yours? I'll let you taste mine. And yes.
Yeah. How many of you here in the audience would say that you have a conscious body image, that you're aware consciously of your body image? Raise your hand if you do, that you're consciously aware of how you look and present, okay? How many of you would agree that your self-image is tied to your body image to some degree? Raise your hand. That if your body image is better, your self-image is better. And if your body image is worse, your self-image is pulled down. You agree with that? And that's not the way it should be. Do you agree with that? Because let me tell you, if you gain 30% of your body mass, that doesn't make you a lesser person. Your body image and self-image shouldn't go up and down together, but the fact is they do, and it does with her.
Because that's how other people see you.
Exactly.
Like she's made the remark, because she's so talented. She plays music, she's good at art, but she's made the remark because I say, focus on those positive things, and she says, but people don't look at me that way. They won't even talk to me because of how I look. So they don't even know the true her.
Right, because they don't get past the wrapper.
Right.
And they judge that. And then she internalizes it and judges it for herself, which is a terrible way for a kid to go through life.
Yes.
Where they feel less than, judged and then judge themselves. Now, next, Kim's niece Emma says she's embarrassed that she, and I quote, let myself get like this. She's going to join the conversation after the break. At school, you get picked on?
Yes. About my weight.
What do you say to yourself?
That I will be able to lose this weight eventually. I just need to try harder.
According to the CDC, 1 in 5 children and adolescents are currently battling obesity. What are the risks associated with childhood obesity?
It's absolutely critical, and nobody really minds a cute, chubby kid in terms of appearance. But what we learn is that if you are obese as a child, meaning that you're carrying extra weight, you are more likely to be obese as an adult. And if you're obese as an adult, you're more likely to have diabetes, heart disease, and other diet-related diseases that predispose you to an early death. So it's really critical to pay attention to obesity rates.
Well, I'm here with Kim, a concerned aunt who says she's worried about her niece's health. And also joining us now is 13-year-old Emma, who says that she has struggled with her weight and the pain of being bullied ever since she can remember. So Emma, I'm glad you're here.
Nice to meet you.
How do you feel about being here?
I'm excited to get any help from you I can. I think this will be like a really good source to help me with this and maybe get a bit better with my self-confidence.
Good. We're in Hollywood, okay? And in Hollywood, we write scripts and stuff. If you could write a script for the next few years of your life, what would it look like?
It would involve me starting to diet more and try to lose weight, and hopefully near the end of it, I will reach my desired weight and be happy with and be better in my mental health and be happy with myself.
Mm-hmm. And so a lot of this is tied to how much you weigh.
Yeah.
Okay. At school, you get picked on?
Yes.
Made fun of, bullied?
Yeah, around my weight.
And when that happens, what do you say to yourself?
I try to tell myself that it will get better and that I will be able to lose this weight eventually. I just need to try harder.
Do you agree with what they say?
Yes.
That's what I thought. Do you repeat it in your mind?
Yes.
A lot?
Every day.
Let me tell you what, that's a really big problem. We can think a lot faster than we can talk. So they might say something that you hear, and you repeat it on 10x.
Mm-hmm.
You can repeat it 10 times faster than they can say it. So you might repeat this 1,000 times to yourself during the day. And it gets to be like elevator music, but it just plays all the time in your head, and it programs how you feel about yourself.
Mm-hmm.
And that begins to change who you are. You're actually scared about your weight as well, right?
Yes.
What are you afraid of?
There's lots of health concerns with being obese and everything, and I'm scared that I might get some, like in the future, like the video I was saying, I could end up getting diabetes if I keep staying on this track, and I'm scared for my health because it can start declining.
Mm-hmm. And you said you need to work harder.
Yes.
Try harder. Do you blame yourself for being overweight?
Yes. You can't really control anyone but yourself, so by me being like this, that's my fault for having that, doing what I've done for basically all my life, overeat and all that.
So it's your fault.
Yes.
And you tell yourself that too.
Yes.
What if I told you that I couldn't disagree with you more? Would you be surprised if I said I don't think this is your fault?
Yes.
Really?
Mm-hmm.
Pretty smart, though. I could be right.
That's true.
Yeah. You have to consider that at least.
Yeah.
Let me tell you why I don't think this is your fault. First off, fault implies intent. You're not purposely choosing to put your health at risk, to make yourself be overweight, to put yourself in a position that you don't want to be in. You're not waking up in the morning and saying, you know what, I'm going to see if I can't balloon up today. I'm going to do this on purpose. So there's no intent here. So fault isn't the right word. Okay, so that doesn't mean you might not have some responsibility in it, that you might not be an active player in this.
That's true.
But I was telling your aunt before you came out, you didn't pick your genetics. You didn't go to the store and buy the food that's put before you to eat. You didn't choose the way the world reacts to you. There are a lot of things that are out of your control. So you're a part of this, and I'm not trying to make excuses for you. I'm just saying, let's just be honest. I got a question for you after the break that may be the hardest question you've been asked in the last 10 years. Emma revealed what her biggest problem is, and it's not her weight. And like I said, I got a question that may be the hardest thing she's been asked in 10 years, right after the break. Why is it hard for you to hear nice things about yourself?
I don't believe them. All my life I've been told the opposite, how bad I am, and so it's hard to believe.
Well, California is making sure students don't go hungry. All students are now eligible for free breakfast and lunch. But just how nutritious are those meals?
These items are honestly really resembling a lot of what we see at fast food sites, which is encouraging and normalizing these food items for children.
A problem, as doctors describe, when we asked to review school menus.
There is a big emphasis on carbohydrate and less about kind of lean, fresh fruits, vegetables, lean proteins.
What about what students are drinking?
There is a lot of sugar-sweetened beverages and beverages with calories on these menus.
The calories, say Dr. Velasquez, excessive in the meals provided for grades 9 through 12. On the upside, there's one fresh item available at almost every meal, but it is the minority and competing with other choices.
We're set up to fail, essentially.
Kim wrote in about her 13-year-old niece, Emma, who has been struggling with her weight and being bullied since she started school. Now, I said that I had a really hard question for you. And are you ready for it?
Mm-hmm.
Okay. I want you, if you would, to list for me the big 7. I want you to tell me the 7 things that you love about yourself the most.
That is a hard question.
Okay, go.
I like my art skills.
Your what?
Art skills.
Okay. All right.
I like my eyes.
Uh-huh.
I like my friendliness to others.
Okay, good friend.
I like my care for animals and the environment.
Mm-hmm. What do you think about the fact that you're struggling to name even a short list of things that you like about yourself as a human being?
I think it's kind of sad.
I haven't known you very long, although I've read every word you've said since we've been interviewing you. I've looked at tape. I've looked at all sorts of things. And just in the short time that I've known you, I think you're extremely intelligent. You're a very sensitive individual. You're mature beyond your years. You're really pretty wise, and I think maybe that's come from pain and having to deal with some things. But you seem to be someone that is really focused on, what life is about. I don't think you would ever do to someone what people are doing to you. I think you care about people. So I think you're smart, caring, sensitive, mature. I could make a list however long you wanted it. And I've only known you for 15 minutes. And you've known yourself for a long time. And I think you're getting crowded out. Those things are getting crowded out by all this other noise in your head. Why is it hard for you to hear nice things about yourself?
I don't believe them. It's hard to hear because all my life I've been told the opposite, how bad I am and everything, by other people. So those thoughts are just in my head, so it's hard to believe. I don't believe them.
She actually gets angry if I say, I'll go up to pick her up on a Saturday and I say, "Oh, you look pretty." And she'll say, "No, I don't. And I don't like when you say that."
Well, I actually think you do have nice hair and pretty eyes, but I didn't even mention that because there are so many other things about you that are of value that have nothing to do with your appearance. And I'm a pretty good judge of people. I'm Dr. Phil. I mean, I got my name on the wall over here. I'm wearing a suit. I'm credible. But you can't tell me why I'm wrong. You can't tell me you're not smart. Are you telling me you don't care about people? You do care about people, right? And you do understand how people can be hurt by mean things and excluding people and missing the essence of a person by judging them without really getting to know them. People that judge you and walk past you and ignore you, they're missing an interesting person if they got to know you, right? You would be a loyal friend. So they're missing out on that.
We need to get dieting out of our culture. It's not about dieting, it's about creating a more healthful lifestyle than the one that's presented to us.
Closed captioning provided by
Lindsay brings the design.
Love this color.
Leslie's all about the dollars.
You spent how much on a stool?
The sisters get these homes sold.
We've thrown our own money to make the changes to bring in the buyer. Herbalicious.
Unsellable Houses. Season premiere Sunday at 8 on HGTV.
I'm sure you saw on the news.
What? That for real? Marshall always talking about the win.
It's a little much. Love and Marriage Huntsville. New episode Saturday, September 16th, 8/7 Central.
Smoking damaged my heart. Now I have a battery-operated heart pump. My tip is, stop thinking this can only happen when you get old. My heart failure happened at 38.
You can quit. For free help, call 1-800-QUIT now.
Did you know sweat from stress is actually smellier than other kinds of sweat? That's why I use Secret Clinical Antiperspirant. It provides 3 times stress sweat protection.
Danielle?
Secret works.
Step right up. Welcome to the Henson & Sons Carnival. The most ghastly goodies in the world.
Halloween plus baking? It's disgusting and so wonderful.
Season premiere Halloween Baking Championship, Monday at 9 on Food Network.
What do you think about teaming up again?
I need your help planning a wedding.
Have you spoken to him yet? Your Honor?
I know.
Your Honor!
Big day.
All Rise. Returns Saturday, September 16th at 9/8 Central on OWN.
Tommy got a curveball.
It's officially a hoedown.
I'm full speed go.
Everything just felt right.
You have been snarky.
I do not like you.
Bang, bang.
Ready to Love. New episode Friday at 8/7 Central.
The family is falling apart.
If somebody's gonna make me choose, I'm gonna choose the person that's not making me choose.
I have family that doesn't accept me now.
Welcome to Plathville Returns, tonight at 10, only on TLC. Who can master the past?
Hamburger helper.
And tackle today's trends?
Gotta make me TikTok worthy.
In this generational showdown.
Crank up the time machine and see where it takes us.
All new Battle of the Decades, Wednesday at 10 on Food Network.
We're both influencers.
What is going on?
There's room for everyone.
I feel like it's no wins in this.
You wish you could do what I do.
Nobody knows what you do.
Love and Marriage Detroit. New episode Saturday at 8/7 Central on OWN.
Essence was about equality. It was uplifting.
OWN Spotlight presents
Saying to ourselves, we are beautiful.
a 5-part docuseries
To be proud.
It was revolutionary.
celebrating 50 years of Essence magazine.
They saw me for who I really was.
Featuring an all-star cast.
Essence changed the way we saw ourselves.
This was amazing.
Essence was a celebration of all of us.
Time of Essence. New episode Friday at 9/8 Central on OWN and stream on Max.
There's someone with us in the audience today. I'd like to introduce Dr. Angela Fitch. Is board certified in obesity medicine, and there just aren't a whole lot of these specialists around. Internal medicine, pediatrics. She's president of the Obesity Medicine Association, and Doctor, thank you for being here, by the way.
Thank you for having me.
When I say that a lot of this deck is stacked against her, setting these kids up for failure with what they're being fed in the schools, she's by default eating convenience foods and unhealthy foods. We couldn't sabotage her anymore if we set out to try, which is why I'm saying I objected to her blaming herself for this and putting all of this on her. Am I wrong? You're the expert in this area. Tell me.
No, you're very much on track. I mean, this is the way I have to commend Emma, first of all, for having the courage to come on the show, because this is a lot of courage to get up here and talk about this. Just as you've mentioned, so much bias and stigma. And the environment we live in is what we call obesogenic, meaning the environment we live in today is producing 70% of Americans having excess weight. And so it's that disconnect between our genes and our environment today that are setting us all up for struggles.
There are some things that we can do, those that are in control of your world, that we can I think willpower is a myth.
It is.
Yeah, I think that's why, people get on diets and they stay on a while, get off of them, stay on a while, get off of them, stay on a while. Right. And by the way, just while we're talking about it, that yo-yo dieting is very dangerous. Exactly. Cardiovascular-wise, it's very dangerous. It puts you at risk of cardiovascular events, right?
Exactly. We need to get dieting out of our culture. It's not about dieting. It's about creating our lifestyle that is a more healthful lifestyle than the one that's presented to us, unfortunately, trying to live opposite of the natural world that's in front of us.
Yeah. There are some things that we, as the adults in your life, can do to really help you have a better journey ahead of you. It doesn't mean you don't have to be an active participant. You are the most important member of the treatment team.
Yes.
But there are things that we can do to stop sabotaging you, to stop putting all of these things in your way, so that when you do the things that you're obviously willing to do and have made efforts at before, that we don't chop your legs out from under you every time you do. This can get better. You can feel better. You can be healthier weight-wise. And we're going to work on this with you and for you. If we get you that help, will you take it?
Yes.
Because we want to do that, and I'm going to lead the charge in getting you some help with this. Fair enough? Yeah. Okay. All right. Well, we're going to let Emma go after the break, but we're going to be working with her going forward. Now, coming up, one of the first teens to get weight loss surgery nearly 10 years ago is going to tell us how that changed her life, but says by no means was it a cure. That's after the break.
Closed captioning provided by
Now take it.
Lifted each other up, and still we rise.
We've held up a mirror, but it's also the promise, our ancestors' greatest dream. Dream come true.
Time of Essence. New episode Friday at 9/8 Central on OWN and stream on Max.
Up until recently, doctors have had a watch and wait mentality surrounding treating children and adolescents with obesity. But things have changed. When Faith was 15 years old, she was offered the opportunity to have weight loss surgery. Take a look.
My name is Faith Ann, and at the age of 16, I was one of the first adolescents to undergo bariatric surgery. My weight has been something that I have struggled with my entire life. In elementary school, they lined us up and weighed us each in front of each other. I was pulled aside where they told me that if I didn't start taking my weight seriously, I was going to be putting myself at risk for a variety of different health conditions. My mom approached my healthcare providers to ask for advice, and at one point she was told, just don't feed her cookies for dinner. At the age of 15, she told me that she had found a program at Duke that offered bariatric surgery for adolescents. Both of my parents had had bariatric surgery at different points in my childhood, so I knew what that looked like. A year later, I underwent gastric bypass surgery. The last 2 years of high school, I spent playing tennis with my friends on the tennis team and becoming more confident. Obesity is often stigmatized in our society, and people often internalize that stigma, and it can feel like it's our fault for struggling with our weight. For me, treatment was revolutionary in realizing that it wasn't my fault.
Thank you for being here.
Thank you for having me.
You listened to everything that I had to say with Emma. Is there anything you disagree with what we were talking about?
No, it's so interesting hearing it back, because every time I share my story, if there's anyone else who's lived through having a higher weight throughout their childhood, I always hear, me too, that happened to me too. So sitting over there, my mom was crying and I was tearing up, because we all have similar experiences, and there's a lot of kids struggling through it.
Yeah, and there are social implications, health implications, body image, depression. It has so many different implications, and it's very complex, and it can change who you turn out to be as a person, right?
Well, I think I'm a special case. I was so driven by my experience that I did decide to go get a PhD, and I work in obesity research. So I don't think that's necessarily the norm, but I do wonder what my life would look like today if I hadn't had access to high-quality health care that I did.
Yeah, and you say in first grade, they weighed everybody together, right? And pulled you aside. And what's that experience like? I have a hard time wrapping my head around how or why they would do that.
I just remember feeling like I was in trouble, and I was a very type A kid, and the thought of being in trouble was terrifying. And my mom wasn't there, so it was really weird to me that they were having a health-based conversation with me without my mom being present. And so that was the first time where I realized that my weight was something that people were going to judge me for, but they were also going to expect me to judge myself for.
You heard Emma say she blamed herself. This was all on her. And the fact is, she doesn't have access to food choices. She doesn't, she eats what she can. And, and that's too bad. How did your friends react when you were growing up? Did you have support? Did you have sabotage? Did you have bullying? What was your experience?
Well, it's interesting because I always remember being on one plan or another in terms of what I was eating, because we didn't have a collaborative relationship with my healthcare provider. So it was a lot of my mom, finding information online and doing the best she could. So we would pack snacks that I would take to sleepovers. But I remember my friends being like, well, can't you just this one night, you would set up the spread and we would watch a movie. And, well, can't you just eat what we eat one night? Isn't that an issue? And then another time I remember being at a sleepover and a friend told me, well, if you just wanted it bad enough, then you could lose the weight. And I remember I just got a big lump in my throat and I just didn't talk the rest of the night because...
Faye says losing weight can sometimes feel like a double-edged sword. While it did improve her mental health, some days she recognized the body she's in. So we're going to talk about that when we come back.
New recommendations to treat childhood obesity now include weight loss pills and surgery. That's according to the American Academy of Pediatrics, which updated its guidelines for the first time in 15 years.
We have guidelines that we hope the insurance companies will recognize and actually start paying for obesity care and not consider it something cosmetic. We need to be able to care for these kids. We need to be able to write prescriptions, but if they don't get filled because they're not covered, my prescription is useless. It's a penny wise, a pound foolish, because if my patient goes on to develop diabetes by the age of 14 or 15 and they have type 2 diabetes, then that insurance company has to pay for their lifelong drugs, diabetic medicine, hypertension, heart disease. Whereas if we can prevent diabetes, it would be so much more cost effective.
Well, for the first time in 15 years, the American Academy of Pediatrics has released new guidelines for treating childhood obesity with medications available to children as young as age 12 and weight loss surgery available as young as 13. Now, after undergoing bariatric surgery, Faith thought she had cured her obesity, but grad school and pandemic showed her that even after surgery, proper diet, exercise, rest, stress management are absolutely imperative. Now, first, let's talk about the surgery. People that I've talked to that kind of yearn for doing that, want to do the surgery, generally think that's the quick fix and the easy way out. And the fact is, there ain't nothing easy about doing it that way, because the post-op procedures that you go through are highly restrictive and a lot of work. Right. True?
Correct.
Was it really, really hard for you, or did you have your mind set because you knew what it was going to be because of your parents?
I think I was at an advantage because I had seen it before, but it was still an adjustment because you're eating very differently than the majority of people who are around you.
Yeah, you're eating very small amounts a lot of times during the day.
Yeah.
How much did you lose originally from the surgery? What was your max weight loss?
The max weight loss was a little over 100 pounds.
Did you gain some of that back?
Yeah, so I've always kind of fluctuated after. So my lowest was sometime right after high school during those last 2 years. And then when I went to college, the freshman 15 is a common phenomenon, and I was not immune from that. And then the stress of grad school and pandemic. So I've recently reestablished my care team with my obesity physicians, and I'm working to I'm right now on a medication to lose, but weight up and down throughout my time after surgery was kind of what I was experiencing.
Okay. But you've always stayed below your highest before the surgery, substantially. And if you knew then what you know now, would you have done the surgery?
Yes.
Okay, so it's not a close call.
No hesitation, yeah.
Okay, that's what I wanted to know, because that's what people want to know.
Right.
From somebody that's been through it, had the roller coaster, because it's not a success-only journey. If you knew then what you know now, you would still do it.
Yes.
And committing yourself to study with this as you have, what do you think is the most important strategy for stemming this tide of obesity and morbid obesity in kids and adolescents today? What do you think is most important?
I think that's a conversation between parents and their provider. We have a continuum of care. We have lifestyle and behavioral interventions. We have medications available, and we have surgery. And providers should communicate the expectations and the results of each. And that should be a communication between each family of what's right with them, for them. But I think what's most important is that families have the option to discuss those with their provider to make the decision that's best for them.
And your mom is right here, right?
Yes.
I asked her if she knew then what she knew now, would she have done it? If you knew then what you know now, would you have done it?
Just knowing her, it did change her course. I've been beat up for allowing her to be a fat child, quote unquote fat child. So I think 100% back her in all of this. I would, anybody that wants to talk about it or do it, look into it.
Yeah. How many here feel like you just genetically are predisposed to having weight problems? Raise your hand. Raise it high so we can see how many percentage-wise. Okay. Yeah. And my hand's up, by the way. I've got 2 nephews that were over 500 pounds, and both died before 50. I had triplet aunts and uncles that were morbidly obese and died before the age of 50. My mother and father were both obese. I had 2 sisters that were obese and are both deceased. It's ravaged my whole family, so I'm not a Johnny-come-lately to this conversation. And I've had to work very hard throughout my life. Fortunately, I was an athlete, and then when I got through with college athletics, I had to say, okay, you had a really high level of activity. What are you going to do now? And so you have to really make some decisions. And we're going to take a break, and when we come back, I'm going to tell you what I think is the first building block, whatever tools you use, however you decide to deal with this issue. I'm going to tell you what I think the first step, the first building block of that is. And it's really important for you as a role model, and it's really important for you, for your children, because those children that are obese as children, the likelihood of them being obese as adults is really, really high. So you want to fight this battle as early as you can fight it. We'll be right back.
Closed captioning provided by
We're back talking about obesity in children and adolescents, and it's really an issue. You know, I said earlier that body image and self-image vary together. They shouldn't. I hope I made the case for that. They shouldn't vary together. You're not a better person when your weight is down. You're not a worse person when your weight's up. But somehow or another, that's how we view ourselves. And you're not going to diet your way out of this. But I said the one building block that I think is important to whatever modalities you use is make the decision to be who you are on purpose. Be who you are on purpose. You know, we see kids living on their phones these days. They're watching people live their lives instead of living their own lives. So you got to stop and ask yourself, am I doing what I want to do on purpose? Is this what I want? Is this what I choose in my life? And if it's not, you need to stop and say, I'm going to be who I am on purpose. And if that means bucking a trend, I'm going to buck a trend. And you want to instill that in your children as well. And it's not always about diet and activity. It has to do with a lot of genetic predisposition. It has to do with your biochemistry. It has to do with a lot of other things. And guilt never got you anywhere. You need to figure out what's going on with you. And that's why you need folks like you. And how many specialists are there? Like,
so that thankfully we're up to 6,000 now. But
well, that's
there's
ridiculous.
115 million Americans with obesity. So that's about, I don't know the math lately, but about 30,000 patients per doctor. And you can't take care of that many people. It's not possible.
Yeah, you should have a very nice practice going for yourself. Look, I want to thank all of my guests today, and a special thanks to Dr. Angela Fitch. For more information about today's episode, if you want to share your story, log on to drphil.com. There'll be a lot of discussion about this on the social media platforms. Join in, support each other, and don't forget to follow and subscribe to my podcast, Fill in the Blanks, or Robin's podcast, I've Got a Secret with Robin McGraw. You can check them both out on Apple Podcasts or wherever you listen to podcasts. Stay safe. We'll see you next time. A few weeks ago, we lost a very special member of our staff, Tony Imperato. He worked tirelessly for many years on our show. Tony was funny, smart, and just lit up the room. He will be missed by all who knew him.